our families back together.
That's such a great point.
And let's look at the other option we have for recreation that most Americans use, and that's alcohol. And that, don't even get me started on alcohol, because we know what happens there, and the addiction and the abuse and the violence, and we don't see that. And it is a safer option for recreational use as well. I'm a hospice nurse. I see patients dying from alcohol disease.
Liver failure.
Way too much.
Oh, it's so sad.
These are young people in their 50s.
Wow.
You know, there's just no reason for that.
I'm going to jump in here. You know, I had a patient in New Mexico who, she was pregnant. She was 9 months pregnant and was hit head on by a drunk driver. And so she was in the hospital and had to have the baby during that time. And thank goodness the baby was fine. But she was left with debilitating seizures and chronic pain and the like. And so when I met her, she was really on a lot of medications and unable to just live life. And we got her on cannabinoid therapeutics, started working through that. She got pregnant again, had another baby. But during that time when she was pregnant, she still needed to use her cannabis because she had seizures from the car accident.
Seizures don't go away just
And
because.
when you're pregnant, there are all these medications, and she was on Keppra, and Keppra is not a healthy medication to be on when you're pregnant. And so we worked with, as a nurse, I was able to help her, arm her with the information, and then speak with her physicians directly to help them understand that using her CBD and her cannabis was a good thing. And her baby was born on time, not premature. He was healthy weight. He's beautiful and amazing and growing and thriving. And she was able to continue using cannabis through the whole process. And it's been wonderful. You know, it's been 3 years. I guess he's 3 now. And just continuing on. And she's able to be a mother to these 2 boys, 2 rambunctious boys. And it's really great to be able to see her. She grows her own medicine. So the boys are even used, they like to go and see the plants that, you know, mama's medicine and things. So you're right, Julesy. It is about a social change. It is about lifestyle and families being able to come together and be open. I know of a family that the son was, you know, smoking cannabis, and the daughter was smoking cannabis, and the dad was secretly smoking cannabis. And I knew all 3 of them were, and I finally said, what the hell are you guys doing? You're over here in the shed, you're over there in the garage, you're hiding out in the bathroom. Why don't you guys sit in the living room and talk about stuff while you're smoking? And it changed the whole dynamic of that family by being able to utilize this plant together, whether that's socially or medicinally. I personally don't care, because we know that we have an endocannabinoid system, and every use of cannabis is a medical use. It's healthy and wellness, whether you know it or not.
Yeah, we like to say that cannabis doesn't know whether we call it therapeutic, medicinal, adult use, reg. Like, it's still the same plant, and it's gonna treat our body the same way, right?
Absolutely. I think this is especially interesting to a lot of the CannaMamas. That's why I was like wanting to get it up, because I know that they want to hear from other health professionals that, like, we actually, what we were saying in the hall, kind of like, we actually do know some things. Like, if there's hundreds of thousands of women that are, that's probably not a large number.
There's a lot. I think there's a lot more than, there's more than you think.
And they're only, you know, we're in these secret groups, and we were saying kind of how it got started was that it started as a parenting group more than it was a support group. Yeah, more like a peaceful parenting support group, and most of us just happened to also consume, so it was like a cannabis consumption, peaceful parenting group that we all met each other in. And Gina is a political scientist. She's always been really into, and then her and I have always just really been into like debates and facts and research and, you know, stuff like this. And so she was dealing with people that have experienced CPS, being called on them, and like,
seeing the same
you know,
stories.
I was
CPS kidnapping children.
Well, and
I
that's a
got
big
to
deal.
Colorado because someone called CPS on me for consuming cannabis with my illness in our old state. And so that's kind of like what got us here. But then Gina and I were chatting one day, and we decided that she should just write a blog, and like we'll just keep referencing people to the link on the blog on what our perspective is on it, and then just from there it exploded.
Of course it did. That's what I was going to say.
We had no idea.
There's so many people, so there's even, I can't say their name, but because it was fully confidential, but it's a famous rock star. And his wife was pregnant, and she was super, super freaking sick, and she was just miserable. And he's like, you know, she's wanting to use cannabis, but she's so scared. And so I worked with her. We did things safely, you know, and got her feeling good about what she was doing. But I wish I would have known about your group. I would have sent her so she could peek around on it.
Yeah.
So it is something you have to be quiet about. It has to be a secret.
So
There's all these women that are part of
shouldn't
this.
be that way.
Gina is the only reason I even felt comfortable consuming when I was pregnant with my daughter. My daughter is 14 months old. I got pregnant with her using common.
Amazing.
So it's not like I'm just, you know, stoner mom, just want to get high, blah, blah, blah.
She tried really hard to get that baby.
So let's
tried
right.
my daughter.
So patients that come to me, this is my experience with
Project
moms.
your voice because they
Oh,
don't.
okay.
They
So
don't have
can you guys
headphones.
hear me now?
Yes,
So this is Nurse Julesy, and when I have a lot of patients that call me from all over the country, and they're like, "Okay, Nurse Julesy, what are our options? We really want to try like oil and you have CBD. We're fine. A lot of the states have the CBD only laws, but what about the THC? So what I like to do is really inform and educate our parents and let them, as a family nucleus, decide what method of treatment works best for them.
Right.
So these are the Western. This is traditionally how we get healed. These are your options at your doctor. We talk about those things, and then from there, how if you wish to incorporate cannabis with that or utilize that only. And you guys just had a guest on here, Colton Turner, and he said it best, like all, because the parents always say, well, he said, I'd rather be illegally healed than legally dead.
That's right.
And a lot of my parents will go up and beyond against CPS and make those choices and say, yes,
I have to clarify, Nurse Julesy. He said, I'd rather be illegally alive, than
Thank you.
legally dead.
Legally
I
alive
had to
than
give
dead.
that shout out to Colton. I couldn't let her continue.
Thank you. I learned it the one way. I know it's long-term memory. Okay, we're
I love
working.
you.
So these are like important life-saving and life-challenging questions that families are having to make these big decisions on. So, and we as medical providers, we give them all their options and we allow them to make those choices for them. In no way would I ever tell a parent what to do. They have to make that decision.
We have a question from one of the viewers for the nurses, and they want to know what you recommend patients do when they're asked to take a drug test. How do pregnant women go about saying no?
What about like, are doctors secretly drug testing?
Well,
Does that
that's what I
happen?
was gonna say. I don't think that all pregnant women know that when that
They do.
happens, they just do it. And, you know, maybe you could find a midwife. I don't think a midwife
Right,
would be
that's
as
our
likely to
advice,
do
that's
that.
what we say.
That would be
Or
the best
when
advice.
you go and work with your your OBGYN and say, listen, these are my methods of treatment, this is what I normally do you support this method of treatment that I've chosen? Do you stand behind me? And then if they do, then great. If not, then go find another doctor.
I'm going to jump in here because the patient I was talking about who was hit in the car accident, when she was pregnant and we were going through this, I spoke with her doctors. I encouraged her to talk to her doctors. They knew that she was a patient on the program with a card, using it.
Right.
She had all of her documentation from her neurologist. And in addition to that, I actually called the hospital and I said, look, this patient's going to be coming in. She uses cannabis. I gave him the whole rundown on what was going on. She's a legal patient. If she's going to have a problem when she gets there after her baby's born in any way, shape, or form, you let me know that right away, because we will then go to another hospital because there's another option. We don't have to come there. We need you to, I need her to know she's coming in to give birth to her child
And she's gonna be
without
safe.
the anxiety and stress of thinking you're gonna fuck with her because of the choices that she's had to make in her own health care. And so, you know, it was really cool because we were able to have that conversation from nurse to nurse. They were fine on the floor, they were
Giving
fine
it
in the nursery, and she did not have 1 second worth of problem. So I think if you get out there ahead of time and realize that you're the patient, you're giving them your business by coming to their hospital to give birth, then you really do have that power to say, this is who I am, I have a legal right to use this medicine, I'm doing it. And I want to know right now if there's going to be a problem, because if there is,
We're
and
sure.
I want it in writing. I want to make sure that you know, that we all know that it's going to be cool that I can get out of here with my child, and CPS isn't going to come and take a swipe first.
I think one of the, and I mentioned this to the doctor whenever he was in here speaking. I mean, you guys, we owe you guys so much for being out there and in the movement and using your voices to like make a difference and to put the other side of it out there, because like I was saying to him, people trust their doctors and their nurses. Like they go to school, they're like, oh, you have to be X amount of smart to become a doctor or a nurse, or so they must know what they're talking about. And so then when we have all these doctors who are just like, it's better to not, or err on the side of caution. They don't have any medical providers telling them like that it is okay, and they don't. So therefore, they think like, if 9 out of the 10 doctors I know say that, not only say not to do it, but expressly say that it's dangerous. Like, then obviously it is. Like, and who are you to think you know more about it than doctors do? And I'm always like, they have to get like a 76% to pass. Like, you have to be a C doctor or a C nurse. Like, you don't have to.
I have learned everything from my patients. I mean, really, honestly. Yes, I look at the research too, but I listen to what my patients say, and if they're telling me, hey, I don't need to take this Ambien anymore, I can sleep with this cannabis, right on. You may not get up and eat raw meat in the middle of the night, right?
Oh my gosh, right?
My husband
Ambien
just
is
left
so
Alaska and hasn't taken Ambien since he left because of cannabis.
Yay!
I've also been treating like his back pain with CBD. And he's like, I can tell the difference. Like, I got him some salve, I got him some like CBD concentrate to like have in a dab pen. And he's like, yeah, I can tell the difference.
So, in going back to your question with physicians, they still see cannabis, marijuana, as a Schedule I drug, and they have a federal drug licensing number that they have to abide by. Whereas in our profession of nursing, and I'm just so proud of our profession, because we actually step out of the box with having state boards of nursing in every single state that we have to answer to. We don't have like the AMA, what they have to answer to, so their hands are tied on. We also, in our clinical practice, is like if there's a missing link, which there is with healthcare, connecting it to cannabis.
Right. So
we have to connect those links for those patients and provide doors for them and answers. And that's what we do with cannabis nursing.
it's such an important work that you're doing. The work that you're doing is so important.
Absolutely, because they want to be built in like this right here. That's why I was all like, oh, we're gonna get live before we start talking about it again. Because I know that we have all these women in these groups that we have a closed group, so somebody can like search CannaMama and find us, and then we have the secret part of it. And then other pages and stuff. But it's all there's all these women who just want. Their question is it okay? Am I harming my baby? Or
Am I a bad person?
Am I a bad mom?
Like, am I a terrible person?
What can I do? What do you think? Because most of us don't want to harm our babies.
Well,
so
that's what I wanted to say. I think there's just listening to yourself. We've grown into the society of needing to trust our physicians to tell us how we feel. Mm-hmm. And if we're on this pill or that pill, this is how we'll feel. And I would encourage your listeners to ask yourself, how do you feel? And how do you feel when you do certain things? And, really evaluate yourself. You have common sense. The doctors were always there just to help in a crisis, not to really manage your health. And so what we become is like every month we go to the doctor because we have a doctor's appointment. It's like this business. And that's not the way it should be. We really should be taking care of ourselves and making our own decisions and what feels right to you, and really dive within yourself to decide, are these things right for me? Are they not? And if you feel bad about yourself because you're using cannabis or whatever, don't do it. If it doesn't feel good, don't do it. But do, if you have questions, it's great to reach out to groups like yours, CannaMamas, that can teach you and help, support you as an individual who thinks you're alone. When you're not alone, I'm here to tell you you're not alone. I have a lot of mamas that are asking that same question.
That's
how
how
going to
it
harm my
happened.
baby. This plant has been on the planet We have an endocannabinoid system that this plant supplements a deficiency that we have. This plant is safe, it is gentle, and as a nurse, it is the safest and gentlest tool that we have. And a patient can use it, self-titrate, do what they need to do. You don't need me as a nurse or a doctor telling you, you need to take 3 puffs. I mean, you light it up, you take a couple hits, and before you know it, went out in your hand because you had enough.
So the doctor,
Right.
we don't like prescribing it because we can't, write an accurate prescription. How many,
Not having
Well,
a
it's a
dosage.
recommendation, just to keep it very strict.
Just like they can't recommend that you eat, a whole cucumber with your salad. This is something that you need to do as you need it, as you like it.
Right.
Smell the strains to make sure you love them before
If
you
it
taste
smells
them.
good,
If it
you-
resonates with you, do it. If it feels good, do it. If it feels bad in any way, you need to stop and check yourself
Yes.
in some way.
I feel like I need to give you like a round of applause there. Like, absolutely.
I think it kind of also does with our mission in CannaMama Clinic about body autonomy, and we have for example, we're against routine infant circumcision, we're against crying it out, using the cry, and those are all examples. I feel like it doesn't feel right as a parent to let it happen.
Don't do it.
So I think that
My boy's out there.
everybody's just so I think everybody's just afraid to be
He's
the
so glad you told
Alright.
everyone.
That decision was made in the South like 15 years ago almost.
That's proud.
Yeah,
I'm proud.
Yes,
I'm
that's
proud.
what you did.
Nursing school is how I learned.
Good for you.
I would never circ a boy that I had because I still clearly remember standing in the nursery.
If
And
we go back traditionally to why
scary.
circumcision started, it was
Scream like
because of
crazy.
cleanliness and keeping disease away. We didn't have antibiotics back then.
Soap and
so
water.
Religion brought that in.
Bath every
to-
day.
I know, yeah.
stop people from masturbating.
Yeah, Dr. Kellogg.
Yeah. But for us, I mean, it's just the part of the bigger movement. Like, we just really feel like individuals have that right to make these decisions for
There we go.
themselves medically. I want to see if we have any more comments before we let the nurses go. Destiny said the hospital locally would have rather me take Norco for
Norco
sepsis
and-
pubis dysfunction versus cannabis. I just don't understand how people so educated could not see the truth.
They're not taught this.
They're
So let me
not.
be clear really quick. Give the medical providers a break, okay? Because I did not learn about the endocannabinoid system in nursing school. Nurse Marcy nor Nurse Julesy learned about it in nursing school, and our doctors haven't learned it either. So right now the statistic is that in medical school, the endocannabinoid system is not taught. It's only mentioned in 13% of medical schools. So they don't know about it. They think it's foo-foo, bullcrap, California wingnut stuff. And they're not understanding that the endocannabinoid system is the largest receptor signaling system in the human body that we've only known about since the 90s. We're just now starting to put these pieces together. So you have to cut them a break, because the last thing that a real physician's going to do is come to a marijuana conference, but they don't know what they would be learning here is really in-depth a lot of information. You're going to learn the science and the research.
Right.
So that's the point of having Cannabis Nurses magazine and having doctors and having this conference that we're at right now, because we're touching people. And it's all about getting that knowledge out. So I'm going to say to your listeners, the way you get to your physicians, because understand they don't know, you take an article, you go on PubMed.gov, and you print off an article. Make sure that when you're searching, you search cannabinoid plus whatever it is, pregnancy or whatever. So you search these and you look at it, make sure that it's something that you want your doctor to look at. and you print it off and you take it to your doc and you say, hey, look, I've been doing some research and I found this and I'd like your advice and I'd like to see what you think about it. I don't want an answer right now because I doubt that you've really looked into this, but I'm going to leave this with you, and on my next visit, I'd like to discuss this. If you could just document that we're going to discuss this next time. What it does for a physician who the last thing that they want to do is hear from a patient that they're going to be taught something, it gives them a chance to take the information and then go and research it for themselves. because that's an empowering thing for them.
Sure.
And then they can come to you with the information that they found. Now, if your doctor has a bunch of crap to say and you know that they're blowing smoke up your butt, then you just say, well, that's very nice, and you just go get another doctor. Again, you are a consumer.
And then you get a
You are in charge of your health care. Do not let a doctor
gift them
tell
a
you.
subscription to the magazine for the
Yes,
next year.
I love it.
So, and a lot of patients are doing that. They're ordering this for their physician's offices.
Thank you so much for making that
And you
point.
can go on
point. Order this.
CannabisNursesMagazine.com, and it's such a good educational tool.
Can we get the articles from the online that are
So
also
it's free
Great,
online.
we'll share your article on our page.
Oh, absolutely. You
Yeah.
can go to issue.
Fantastic.
It's published usually on issue and through
That's
our webpage.
Gotta have it in print and online these days, you know.
We were trying to get a brain when we came out a year ago, but the nurses and the doctors, and especially the patients, they were taking these, highlighting them, bringing them to their doctors, and having actually full-on discussions. So
That's
it's,
awesome.
and so this is what I say: people have fear. Fear is the #1 reason why we still have prohibition today with reefer madness. And there's a new reefer madness of today with these cookies in the back pocket and the new date rape drug and all that. Whole other topic for discussion.
Sure.
But education will and is the solution to the fear factor that we have. When you educate them behind the science behind the plant, they have nothing else but facts and evidence. And then if they choose to ignore that, then those are some, critical decisions in your healthcare plan. And what do you want them part of your care plan?
No.
Okay. So if not,
Legislators and lawmakers here today learning as well at
right.
this conference.
And
So
encourage.
that's
I bring like conferences like this. I'll take these conference options and print it out and say, hey, and post this up. And many doctors will post it up in their offices now and encourage their nurses to go too. And it's just been a wonderful educational opportunity.
So did you hear that, Patricia? They both just answered your question without even having to ask. It's fantastic. She asked, would you ladies think it would be effective to pass out info to physicians,
Absolutely,
police?
absolutely.
We would say
Your
legislators.
police
Yes,
departments
yes.
too, because they do trainings that's all about addiction. It's not an addiction; it's an endocannabinoid deficiency. So let's give them the science behind that, and they'll go, oh. So then they can speak correctly and informatively with research behind it.
Thank you so much.
So you're welcome.
Thank you. Thank
What
you
you
so
guys
much.
do, it's huge. Like, thank you.
And thank you for giving us your time.
And thank you all for creating a supportive network for moms.
Yeah.
Marcy's getting ready to talk right now.
I know we gotta go up there. We're gonna go.
Okay. I take it. Can I get another?
Yeah, it's a live camera. I know.
I think so.
Thank you, ladies. That was so fun.